Chair, press should be joining us shortly. I've just started recording as well.
Okay, so we'll get started as it is 2 o'clock. So, good afternoon and welcome to this meeting of the Social Care, Health and Wellbeing Scrutiny Committee on the 28th of January 2021. Just to make you all aware, today's meeting will be recorded. Can I also welcome any members of the public and press to today's meeting? Can I kindly ask you to observe the meeting only and not speak or participate? Can I please remind everyone to switch your phones to silent for the duration of the meeting? In addition, can I refer you to the protocols for remote meetings which have been previously circulated? Namely, your microphones should be switched to mute unless you are speaking. Should you wish to ask a question or make a comment, can you please indicate either via the chat function or by raising your electronic hand via Teams? I will assume that you've all read the paperwork before us today prior to the meeting. Just a reminder to only use the chat function to indicate if you wish to speak as an alternative to the electronic hand function or to raise any technical issues. When asking your questions, can you please indicate which page number you are referring to? So the first item on the agenda is to do a roll call. I am Lynette Purcell, I am the chair and I am present. And I will now call on Charlotte, the Democratic Services Officer, to take the roll call.
Yes, Chair. So Councillor Charlotte Goldsworthy.
Present.
Councillor Arthur Davis.
Right here.
Councillor Oliver Davis.
Present, Chair.
John Miller. Councillor Miller. No. Councillor Patterson.
Yes, present. Present.
Councillor Sonia Reynolds.
Present.
Councillor Dave Whiteblock.
Present, thank you, Charlotte.
Councillor Arwyn Wilcock.
Present, Chair.
Councillor Carolyn Edwards.
Present.
Councillor Wyndham Griffiths.
Present.
Councillor Helen Clark.
Present.
Councillor Nicola Davis. And then Cabinet members, Councillor Alan Lockyer.
Present, Charlotte.
Councillor Peter Richards.
Present, Charlotte.
Councillor Carol Clement Williams.
Present, Charlotte, and I'd like to thank the chair for allowing me to attend today.
And then officers, Andrew Jarrett.
Present.
Angela Thomas.
Present.
Ben.
Present.
Natasha Mond.
Present.
Hodges.
Present.
Any officers or members that I've missed at all? No, Chair, I think that's everyone.
Thank you very much. Okay, so we now move to the chair's announcements. And first of all, I'd like to thank, on behalf of the committee, every single member of the Social Services Department who've been involved in any way in helping out with the disaster that we've had recently in Skewen. We know that people have been working way beyond their job descriptions. They've been working way beyond the hours they're supposed to be working, with the greatest of enthusiasm and wonderful camaraderie, which I think says a great deal about the atmosphere that there is amongst the workers in social services. Morale, I think, is very good considering the circumstances. So thank you very much. The items which we're going to scrutinise are as on the agenda, and we have decided that we will be looking at the Cabinet papers. So at that point, we will be going into private. So we're now on to the next agenda item, which is declarations of interest. Have we any declarations? I can't see any. Charlotte, Democratic, can you see any?
I'm just checking now, Chair. No, I can't see any. Oh, hang on, Councillor Goldsworthy's got it.
If I declare I'm a PA for my mum.
Right. Okay. Yeah,
Okay.
I'll send you a declaration form, Councillor Goldsworthy.
Thank you very much for that, Councillor Goldsworthy. So we're now ready to move on to agenda item 4, which is the minutes. Have you all read the minutes, and are we prepared to accept it as a true record? Okay. If you indicate only if you are not prepared to accept it. Everybody happy? So can I have a proposer to
I'll
accept?
move them, Chair.
Thank you. And a seconder.
I'll second, Chair.
Thank you very much indeed. So we now move on to agenda item 5, which is the verbal update on COVID. Who's going to present this?
Chair, sorry, I've got my hand up. It's Andrew Jarrett, the director. I'll start off if that's okay, Chair, and then I'll hand over to the heads of service.
Brilliant.
I'm not going to do what I did last time, which was death by PowerPoint, you'll be pleased to know. So I kept you probably half an hour last time going through in some detail our response to COVID across the social care sector, some of the challenges we faced. I was describing to you the dramatic increase in numbers that we were facing as in the run-up to the beginning of December and then the run-up to Christmas. The fact that we really did feel that there needed to be further intervention by Welsh Government as far as further lockdown was concerned. When I spoke to you last, that wasn't on the cards, but obviously it did happen. And that did lead then to numbers over the Christmas period and New Year period starting to fall, which was positive news. What we haven't seen is a corresponding fall in the pressures that we're seeing across the service. Not really sure why that is, but we certainly still have particular pressures across domiciliary care, residential care for older people, but also we've had pressures in residential care for children's services as well. So it really has the COVID-19 pervaded through all of our services over the past month or so. So we're not seeing a decrease of the pressure, so we continue to manage that. And I'll hand over, Chair, to Angela Thomas, if that's okay. She's got a brief presentation, and then Kerry will do a brief presentation on the position that children's services have found themselves in. I've asked them specifically to concentrate on updating you since the last meeting that we had, rather than going through it all again, you'll be pleased to know. So I'm hoping that you'll remember where we were last time and follow my brief synopsis, and I'll hand over to Angela, if that's okay, Chair.
Thank you very much.
Okay.
Welcome, Angela.
Thank you, Chair. If we could just put up the slides on the screen, please. Okay, so this is an update on adult services from the 4th of December to date. So I'll go through it in order. So I'll start with residential care. So what I've provided here is a breakdown summary of some of the statistics. So we've got 24 residential nursing homes in East Talbot and 2 border homes in Powys. During this period, 25 of those homes, so all but one, have been in lockdown. And as we stand today, 14 homes are currently in lockdown. And that's where there's been a positive case of COVID and they're unable to take admissions, so they're closed down for 28 days. Resident occupancy levels are around 75.7%. Pre-COVID, they were 95%. But just a word of warning here, that is an average. Some homes are dipping below the 50%, and at the moment they are being propped up by Welsh Government Hardship Fund. We don't know how long that money is to continue for, but as you can see, that we've got a significant number of homes now that won't be viable if that money wasn't to continue. We have 5 homes of concern. When I say concern, these will be meetings of IM&T, incident management team meetings, which you can see towards the bottom. That will be around infection control. But then we also have things called escalating concerns, where we have concerns for residents, etc. And if I were to tell you, I've had 5 such meetings in the last week. So there are still issues in residential care. As you can see there, staffing absence rates are anything between 24% and 85%. All care home visits have ceased and have done for some time, other than end of life, and it's at the discretion of the care home if they will allow people into a home. Visits have been taken outside of the home, but most homes are reliant on visual aids, so using iPads, etc., to be able to speak to families and loved ones. I continue to hold provider meetings with the residential care sector, so that's keeping them on board with things that are happening on a daily, weekly basis. That's all positive. Mutual aid, we did over the Christmas period actually have to go in and prop up some border homes, which we did during Christmas and the New Year. And then, as you can see there, Cwt Clwyd Gwyn, which is the residential care home that was affected by the flooding in Sgwyn. That home is run by HC1, and all 32 residents were evacuated on the evening of the flood to 2 homes in Swansea, 1 in Morriston, 1 in Llansamlet, 1 home in Ammanford, and then 1 home in Neath Talbot. But that, I have to say, that was handled very well by that team. It goes without saying, I think second time round of COVID, the residential care homes in Neath Talbot have been hit harder than first time around. So I move on to domiciliary care. We have 19 external agencies plus the in-house home care service. Early days, we RAG rated all our Neath Talbot clients. We continue to do that. So we've, up until this stage, not had to withdraw any of our green calls. I know some authorities have had to stop things like shower calls, etc. We haven't had to do that yet. We did have an issue with 2 providers on Christmas Eve, but all of our in-house services came together. Some people cancelled their leave and nobody went without any care. It was only for 1 day on Christmas Day, but that was the only, and nobody went without care, as I say. All the families were contacted and it went fine. I continue to hold provider meetings with the domiciliary care and in-house external markets. What we've agreed is a whole sector approach to the pandemic. So if any one provider was to go under, unable to get to their calls, we would take a whole sector approach. So if we've got some providers in Sandfields, perhaps there's 2 providers in Sandfields, we just accept that 1 would pick up the calls and perhaps 1 provider would go to Neath. So it's been very, very positive, and I have to say that sector has pulled together. The Sgwyn incident, you'll be aware that families have gone to live with loved ones and, you know, to get away from the flood, etc. So we're fully expecting there to be some further outbreaks in the community. It goes without saying that will happen. And we were informed 2 days ago by our track and trace teams that there are 2 cluster outbreaks in communities. We're keeping a close eye on that. Just for the committee to be aware, I mean, I think we got off lightly first time around, and I'm still touching wood that it hasn't impacted on the domiciliary care market to date. I still can't believe that hasn't happened. It seems to be that residential care has taken the hardest hit, but I'm still holding my breath and preparing for the worst in the community because I just don't think we've got there yet. I'll move on. So the next slide, we'll talk very briefly about day services and supporting living arrangements. Prior to the lockdown on 19th of December, we were providing a very, very limited respite provision to 7 people, 7 individuals, and that was literally on a social services transport bus for an hour, and then having to deep clean the bus and then pick up another person. That's now down to 3 people. Because it was in the summer, as you recall, we could take people out for walks in parks. Well, all of that has stopped now, so this is very limited. All our day services, including overnight respite, are closed. But we have got some families who are really teetering on the edge, families that really can't cope, and we did have to take 1 person into our Tremor respite unit just lately. In the supported living arrangements, we have 36 small residential care settings and 57 supported living schemes. These are places where there are 2, 3, 4 people living in that supported living arrangement. The Welsh Government guidance caused us much angst because it was open to such interpretation. So we were left at Christmas with this issue about who could visit, who could form bubbles. And whilst individuals could go back to families and form bubbles, they were then coming back to a closed setting. Because even though they're in these settings, they do share facilities like kitchens and living rooms, etc. But, touch wood, nothing untoward has happened, and we've got through to where we are today. I'll move on. I won't spend a long time talking about the next slide on homelessness because I've mentioned this to you before. It says it all, that they were the numbers that we were looking at in March 2020. We've plateaued at around 130 individuals that we're still requiring to support in temporary accommodation. The priority need assessment will not be removed, so we will have a duty to take on people when they present as homeless. But what we have got now is a short, medium and long-term plan, how we're tackling it, and we've got a strategic working group with RSLs and corporate partners, which is chaired by our Cabinet member, Councillor Peter Richards. So yeah. Just to talk a little bit about contingency planning. So when we realised it was going to get as bad as it was the other side of Christmas, we went out to a call to staff, and I spoke to every member of staff, and I was overwhelmed by the 200 people that put themselves forward to say they would support whatever needed to take place to support adult social care. We put training in place for people along PPE, medication management, manual handling. Staff rotas are in place. We're ready to move to 7-day working. As I said, we provide mutual aid to Powys, and we have what's called a regional standard operational procedure across the region with Health Colleagues and Swansea. Suffice to say, this has been very, very difficult because the area that we've needed more support than ever is residential care. Many of our staff who have gone in to support residential care settings have gone on to contract COVID themselves. Some are poorly. But despite that, even though, if I told you today we have 2 agency officers and two training officers and 2 support staff in one of our care homes, and will be there all this weekend as well, that people are going the extra mile, but it comes at a cost. And we are, just so that people are aware, we are prioritising these people for the vaccinations prior to them going in. Good. Along the lines of some sort of business as usual, we're continuing to move forward with the remodelling of adult social care. Phase 1 concludes on the 31st of January. We've made some appointments at principal officer and team manager level. The consultation feedback to staff and trade unions will be going back to them on the week commencing the 8th of February, and we'll be implementing the first phase of the remodelling on the 1st of April. And this is, as you will recall, members moving to 3 network-based all singing and dancing teams. Phase 2 will then commence beginning of April also. And just to end on the final slide, and it's just something to bear in mind, it's not for discussion today, but we're starting to have conversations in adult services. What is the future for adult services post-COVID? So some really thoughtful conversations about, is residential care going to be the care of choice for people, given what we've heard in the last year? I think personally there'll be a requirement for more domiciliary care and respite services. So we're seeing an awful lot of people managing, but families would manage so much more if they just had that short break now and again. So we're looking more at respite services. We're reviewing all our extra care arrangements. We don't actually manage the people going into extra care. They're run by the coastal RSL, but the nomination list is managed by Titarian. Well, that makes no sense to us. It needs to. Myself and my management team need to be determining who are the next people to move into extra care. So examples I'll give you are people who are having severe strokes in their 40s. It's likely that they're going to require significant care in their 50s, 60s, 70s, etc. So we need to be planning better for that for the future. The whole of the remodelling of adult social care is around enhancing community support, additional local area coordinators, etc., etc. And a bigger thrust, I think, that we'll need for informal carers. We've spoken before about the fact that Neath Talbot has something like 20,000 unpaid carers. And it's how we bring all that together in these communities. So a lot has happened in communities as a result of COVID. We don't want to lose that, but it's how we enhance it. So I think during the course of the next few months, I'll be bringing some papers along to Scrutiny for us to debate some of these issues moving forward. And that's it for me, Chair. Happy to take any questions.
Thank you. I think before, Andrew, did you say that Kerry was going to present as well?
That's correct, yeah.
Right, I think we've got so much to digest. It'd be a good idea if we had questions to Angela first and then had Kerry's presentation and then questions to Kerry. So who is indicating? Lots of people. Arwin, fire away.
Thank you, Chair. Thank you, Chair. Yeah, just a couple of questions, really. Angela didn't mention, or have I missed it, how many residents and staff have been vaccinated in the care homes? And secondly, the residents transferred from Skewen, Chair, and I know that this had to happen very, very quickly. But I think Angela mentioned about 3 care homes that involved four. Okay, sorry, Angela, 4. I'm just wondering, how did we manage to check if those had been tested, or were they tested with a lateral flow, giving us a rapid result before they were transferred to those alternative care homes? Thank you, Chair.
Okay, so in terms of vaccinations, Health are taking the lead for this, but we, as far as I'm aware, all of our residential care homes in Neath Talbot, residents and staff have been vaccinated, apart from a very small cohort who already had COVID. So you can't have the vaccination whilst you got it. But I think we were up to 90+% of people received the vaccination. So that's the first one. In terms of the transfer from County Gwyn to the 4 homes, all of the residents' families were contacted that evening. All of the homes that these residents were transferred to are COVID-free. They're all run by a company called HC1, a national company, which made it easier because they had far more homes at their disposal to be able to transfer these people to. So I've been questioned by Public Health Wales. They're quite happy with how this worked. It was a very slick operation. They brought in their own ambulances. They decanted the residents with the staff who run the home. So there was a very smooth transfer. They let 2 people remain in the home just to make sure they hadn't missed anything in terms of personal belongings, medication, etc. Those people are still working in those other homes where the staff have transferred to. So from my perspective, I was still talking to the manager of HC1 at 10, 11 o'clock that night, but it was very, very slick, I have to say. So yeah, it worked really well.
Happy with that, Councillor Woolcock. That does sound very, very impressive.
Very, Chair. That's very pleasing and very, very good news.
Yeah, excellent. Thank you very much, Councillor Paddison. Suzanne.
Thank you very much, Chair. I'm absolutely blown away by the morale, as the Chair's already said, of the staff, and that is testament to the staff we've got. So I've got to get that off my chest first of all. But because they are volunteering, Angela, and you did mention something about 7 days a week, you know, we've got a 7-day rota now. We are still keeping a close eye on our staff, because we can't, you know, you can flog a willing horse to death, basically. And I just wanted reassurance, and I know what the answer is going to be, but I need to ask the question.
Yeah, no, that's fine. Can I say?
And there's one other question then. When they do volunteer for jobs which are not their normal roles, do they continue to get paid for the role in which they are mainly doing, or not?
Yes, right. On the first question then, sorry, when I say 7 days, what I should have explained, that would be 5 in 7 days. We'll be preparing on a Saturday and a Sunday. So yeah, we've taken very good care of the staff, and we're making sure that nobody's doing a 12-hour shift, for example, in a care home. We've split it between, I think it's 8 till 2 and 2 till 8. You know, we've had 2 people on 8 till 2, 2 people on 2 till 8 to give it some balance. We're very, very cautious of not exhausting the staff, because they have, and in terms of payment, absolutely. People will get paid, and they'll get paid on top for volunteering. I would not expect anybody to go into a residential care setting and not receive payment for doing so.
I fully expected those answers, Angela, but it is due to me to ask them. Thank you very much.
Yeah.
Thank you for that question, Councillor Pattison. Councillor Goldsworthy.
Afternoon all. Just following on from Suzanne's, and obviously this is a meeting with the budget and income generation and that as well. When obviously you say that we are obviously paying, for the additional and as volunteers, etc. There's been obviously a number of the care homes which have had issues throughout COVID, where you basically put teams of management in as well to overrun it. Have we actually had any income from that care home itself as a private operator into the council for the services we are sort of given, or is there a rule against it?
No, what we'll be doing is any additionality, we'll be making a claim against the hardship fund that's been made available to keep homes afloat. So what we don't know at this point in time is how long that hardship fund will continue. But I think all the noise that we hear from Welsh Government is that they don't want homes to close. That, you know, when we come out of this the other end, we'll be looking at what occupancy levels look like. As I say, some have dipped below 50% and wouldn't be viable. You're only viable at 95%. So we're keeping a close eye on that. But no, any additionality that we're putting into support care homes, we will be making a claim by our accountants back from the Welsh Government's hardship fund.
Thank you for that.
Thanks.
Good question. That. Thank you, Councillor Goldsworthy. Councillor Reynolds.
Thank you, Chair. I was really pleased to see the forward look and the planning for the future in all of this, given what we're going through at the moment and what staff are achieving at the current time. So, you know, kudos for that. And also, you know, reiterate comments made about, you know, how pleased we are with what's been happening and how the staff have been going. In terms of the forward look, and it links into the budget discussions, I think you've indicated in that forward look that residential would be you'd be looking at prioritising domiciliary care to residential in a way that I quite understand that there may not be a push to residential care. I wonder, my concern would be maintaining and ensuring that we have sufficient, because I'm aware of people who currently are being looked after by relatives where that situation, once people have to go back to proper work, etc., cannot continue, and where there is, you know, ongoing 24-hour care needs, and that's unaffordable, you know, within a domiciliary arrangement, in my understanding. So there's that. There's again, I'm pleased to see that you're looking at reviewing the extra care referrals. I don't believe the referrals are happening correctly at the moment, from my knowledge of the system, and I am really quite concerned that we're not referring the right people into extra care, and that's not been a council issue up till now. I'm glad that's happening. And I'm following on from comments about staff and the extra work going on. I'm very aware of the stress on many of us and many staff, volunteers, etc., across the board. And I'm wondering if you've factored in the additional time and time off and the respite required for staff going forward.
Okay, I'll ask the first question on residential care. I'm not suggesting that we cancel residential care in favour of domiciliary care. What I'm saying there is I think there might be a movement with the general public, families generally, not thinking that residential care is the right place for their loved ones in the future, given what's happened over the last year. What I think residential care will become is EMI dementia care, where families simply can't cope, and it'll be at a time when people move into residential care when they really don't know they're moving into residential care, if I can put it as politely as that. The days of people opting for residential care, self-funding, which we do have, people do decide to move in, that may still be the case, but I do think that there'll be a shift. And this is just my thinking and my management team's thinking. This is only what's come out. We've seen a much bigger growth in the community of families unable to cope with people who are very quickly moving from what would be residential to nursing needs, dementia needs, and many of our residential care homes now are absolutely dealing with the heavy end people. That's the reality. So I think that might be a shift. In terms of, you're right, 24/7 domiciliary care isn't an option, and we've got a fairness in service provision policy, haven't we, that we brought through this committee, that we will provide care in the community up to the extent of a residential care package. That is our policy. That will in all likelihood be challenged, but that is our policy as it stands, and that remains. In your second question around staff and factoring in extra time, we've been at pains to ensure that people are having time off, and that starts from my management team downwards. If people are starting to wobble, you know, then yes, we're absolutely ensuring that's happening. And all I can say is that we've been a very strong workforce. People pulled together. We continue to have I meet daily with management team twice a day, depending on what crisis we're dealing with. We've got principal officer team management meetings. As part of this remodelling, I've met with every management team. We continue to consult on what we think the right way forward. So yeah, and people are taking their leave, you know, I'll own up, I'm not taking mine, but people are, you know, and we're making sure that as best we can.
Yes.
Thank you very much, Angela. I anticipated that would be the case.
Thank you very much. Again, some very interesting and worthwhile questions there. I've got the director indicating he would like to come in.
Yes, thank you, Chair. Not to prolong the conversation, but just to say about staff, it is really important that we provide them with the opportunity to have a rest now whenever we can, and that's not easy. I think into the future, we will be having to think about the impact of long COVID. So the impact of COVID over time and how we build that into making sure that we're looking after staff, because that can be, from what I've heard, very debilitating and can last for a long period of time. So where we've put staff in harm's way or they've contracted the illness, and that does have an impact into the future, I do think we need a really measured and supportive approach to that as we go forward.
Thank you. Cabinet Member Councillor Richards.
Do Angela want to go first? Ange, do you want to?
Sorry, could I just come back to add to what the director said there? That's absolutely the case. So what we are seeing is from our reablement services, where we normally say reablement takes up to 6 weeks. For some people, this is turning into 16 weeks and longer. So it's not a short, sharp piece of intervention. It's a much longer. So we are trying to consider all this in the round, particularly older people. So yeah, it is having that impact.
Thank you for that. Councillor Richards, Cabinet.
Just to come in on a few points, Chair. Thank you. Angela mentioned the Christmas period. You know, I have to pay tribute to the efforts of the team over the Christmas period. It was a very challenging period with staffing levels, but the way the team stepped up, including volunteers, was fantastic. You know, we did have a few issues over the Christmas period, but everybody was working, everybody was contactable. So, you know, it did go. I want to just come on about the flood in Skewin, and I have to pay some tributes to some of the individuals from the service who really stepped up on the weekend. Leighton Jones in particular, who got the centre, Corridor Centre up running so swiftly and managed his way through that. And I'd also like to pay tribute to Adrian Bradshaw and Nune, who actually manned the Abbey Infant School. Again, you know, that was phenomenal. And the way Arwin mentioned that nursing home, the way we evacuated that was fantastic. You know, we put them into 4 other homes. Again, and the LAC played a major role in Skewin, in coordinating some of the issues up there. And finally, every day is a challenge, but the way the team are stepping up at the moment and the way we communicate in all as a team, you know, we can't fault it. On the subject of homeless, Angela mentioned homelessness. The work we're doing in homelessness at the moment, we're having some positive results. There's a paper going tomorrow to the Housing Forum, which I chair. I think you probably get the paper coming here eventually, but some of the positive work we're doing accommodating some of our homeless, you know, is element of achievement. Carers, again, carers a challenge at this moment in time, but we're trying to balance everything and working through it. I'm attending the CBS AGM tonight, and I'm sure carers will be top of the agenda there tonight. So that's just my little take on something. So thank you.
Right. Councillor Clement Williams, Cabinet Member for Finance. Did you want to come in at this point?
Yeah, it's just some new news that we've had. Angela mentioned the funding moving forward. Just for information, and again, you may not have received this, senior officers, because it did come in late yesterday afternoon. But we've received a copy of the Welsh Government funding terms and conditions yesterday, and they have topped up the local authority hardship fund by 6.5 million. So I don't know how much longer it will go on for. You know, that's obviously up to Welsh Government, but it is good news that there is more support financially out there for us. Hope that helps a little bit.
Thank you for that. Councillor Goldsworthy, was it a question for Angela?
Yeah, I think it's just going on what Peter have said about obviously, you know, everyone stepping up in skewing, and I gotta say, skewing has been a perfect example of how our LACs work and should operate in the coordination, knowledge, and everything within a community. Emma and Christy have been absolutely godsend, way beyond their role, way beyond it, social media, everything. And also it's the way in which they have actually helped Mike Harvey as well, the councillor. So I think, you know, as a committee, I would love it that obviously it goes back to them to say how much they are appreciated, and a big well done.
Thank you very much for that. Well, the fact that this is a public meeting and we're publicly expressing our thanks. And before we go on to Kerry, there were just two things that Angela mentioned. I mean, just two amongst many, many things that Angela mentioned that particularly struck me. First of all, was this whole sector approach amongst the domiciliary care teams. We know that in the past there has been perhaps a little bit of silo working going on as far as residential care providers, but the fact that when our backs are against the wall, somebody has described COVID as being like a war, and we're getting a little bit of the blitz spirit, you know, well, we've got to do this, so we just think outside the box, and you go to Neath and you go to Skewen. Yeah, that is excellent. And obviously, before we go on to Kerry now for her presentation, our heartfelt thanks. It's just been absolutely amazing what we've been seeing. Councillor Goldsworthy, unless it's a question and unless that's a legacy hand, I mean, minded to go on to Kerry Warren now, because we have
legacy, sorry.
as well. Sorry, Councillor Goldsworthy? Was it a legacy?
Yes.
Yeah, okay, brilliant. Okay, is Kerry there? There she is.
Hi everyone, good afternoon. My technical advisor has had to come in, so everyone's going to meet Richard as my battery is now showing as low. So with all of this activity, no doubt the dog is about to join in as well. So hold on a sec. There we are. Yeah, good afternoon everyone. Just picking up on what Andrew said at the start. I asked my principal officers to come together and just put some bullet points with an update for members over the last few weeks. You will see that they've gone much further than that, and probably it contains more detail than was necessary today. But I think that just shows how much they want to share information with you. So hopefully you will find that relevant, and I will pick up on the highlights. It must be said, it is always easier going after Angela Thomas as Head of Adult Services, because that does help me greatly. And I will say, just starting off with my own sort of observations of the last few weeks in December and January, just to give you reassurance with regards to workforce and picking up on some of the things that I've already said. We are staggered, you know, we are staggered by the way in which to respond without question to everything that we ask of them. That does require working longer hours, and it does require a 7-day week when necessary. But rest assured, I think we recognise across the whole directorate our workforce is our most precious resource, and we support them as well as we can. So we probably don't follow their example, but they certainly don't follow our example. We make sure that they take breaks. We are encouraged to take their leave. Also, we've got a close working relationship with HR, and again they are stepping forward to support members of staff. At this point in time, over the last few weeks, most of us and most members of staff have been affected either directly or indirectly by COVID. A number of staff have been unwell, some seriously so, and we've also had staff who've got caring responsibilities, staff that have children at home, and during the Christmas period, everybody just got together to take a look at how we were carrying out children's services business to make sure that that was fair and that everybody was getting a break and that those members of staff particularly affected were being supported. So the workforce remains healthy. And as you'll see as we go through these very detailed slides, I will pick out the highlights as we go forward. So my other technical advisor, Natasha's going to help me. So if we can go on to the first page, Natasha, please. All right. So what the officers wanted to do was let you know their areas of responsibility. So this was in relation to Vic Smith talking about how our fostering team, our looked after children service, leaving care, her link with the adoption service, the contact service, and the children with disability team, and she's the lead for autism. And that's helpful actually, because that shows you perhaps what each principal officer has within their portfolio. The main points that I would want to make with regards to looked after children is that we've gone some way to support our foster carers and the children that they look after. And bearing in mind that those carers fit within the high risk category of in their 50s, in their 60s, we have had a number of carers that have been unwell. As I've said before in other arenas, we've lost a few carers, either directly or indirectly through COVID, and they've been absolutely tremendous. You can imagine the anxiety they face when we're asking them to support other families, which we've done, where placements have been fragile, and they've come forward and they've had their own support workers. And what is allowed is for our looked after children population to remain stable. So we've not seen the rise in placement breakdown that other local authorities have suffered. And with regards to our leaving care service, we've been able to make sure that we've supported those harder to reach children, in particular during the Christmas holidays, so that they've had support during those difficult times when they haven't been able to get out and about and meet with friends and family as they would ordinarily do. With regards to our adoption service, I'm pleased to say that has slowed down in January. Business slowed down, but healthy position, and we have the majority of children now who are waiting to be adopted matched with potential carers. And to achieve that, I think during COVID times is pretty special. With our contact centre, that's something that we've worked incredibly hard with the staff to ensure that we've remained COVID friendly and allow children to see their families. Now, we've been very cautious with this regard. There's been times over the last 12 months where we've been able to relax the arrangements and where children have been able to see their families over a period of time. But as you'll appreciate with these current restrictions, we have had to be very careful. We did manage to get the majority of children to see their families prior to the Christmas period. But again, we are back in a position where all of that has to be in keeping with the current regulations. In terms of our children with disability team and Neath for autism, as Vic is, what I would say is that we've had some children unwell. So we're recognising the vulnerability of children with underlying health concerns. And we have had some teenagers that have been quite unwell over the last few weeks. We are working with their families, and I have to say the hospital and sort of support from health has been tremendous. But I think it does it does highlight the fact that I'm not absolutely sure whether we fully understand this this virus, and younger people are becoming unwell as a result. I think if we move on to the next slide, Tash. Yeah, and it's really important in terms of, we've got a multi-agency panel looking at children with complex needs, and that's part of a wider sort of priority across the region. Again, I would just like to say that that's gone from strength to strength over the last few months. Partners continue to be supportive. Vic Smith leads on that programme, and what it does do is it allows us to focus on those most vulnerable youngsters, and you'll see from some of the stats later on, we've got very low numbers really across the, you know, if you compare it across the country, of youngsters that are in residential provisions, and it allows us to be quite creative with the care planning. So I'll give you an example. We've had, you know, the service has been under some pressure during COVID times, and over the last couple of months leading up to Christmas, we were in a position where we had a couple of teenagers with additional needs, and their home placements were very fragile. I think the pressure of being at home, living in a closed setting with their families, with their siblings, was proving too much. And some of those, one family in particular, it got quite serious in terms of a teenager who's quite a big lad, presenting with some very challenging behaviour. He's got a number of younger siblings, and it would have meant us looking for either somewhere safe for the younger siblings to stay, or for this young lad to move into another provision, which would have caused its own difficulties and escalated things probably even further. So in terms of how creative we're being with regards to youngsters with additional needs, we rented out, and we've done this before, we've rented out 2 what are holiday lets, which allowed, and it's quite a big family, it allowed the family to stay together, for that young person to be supported by staff in one of the houses, and the family to be in the house next door. It allowed them to have Christmas together, and for those specialist services to go into that home. I have never seen such a transformation in a family ever. The younger siblings, the difference in them, and obviously we were becoming more concerned about their safety and well-being. That was tangible, and this young person, although it's never easy and straightforward, certainly he was able to stay there while we had a planned move back into the community, and education and health supporting us then with regards to his longer term needs. So that was a tremendous piece of work during COVID times, just before the Christmas holidays. And I think, you know, if you'd seen how keen the staff were to get involved in that, and then meeting with them after the holidays, it gave them such job satisfaction, because, you know, you could see the more positive outcomes. So if we move on, Tash. Okay. Yes, the only comment I'd make is regards to virtual communication. And I know we've talked about this before, but I think, you know, as the year has gone on, we have become so much better at communicating with families, with children and young people over the internet. And we've been very proactive in making sure that we've taken every opportunity to engage with those harder to reach families and those young people that we're looking after, and also on a voluntary basis. I do think, however, though, being very honest with you, that you know, that started off, and we were very excited about that, and it allowed us to communicate in a way that was safe. We've got very good at it. Children and young people are often better at us on this sort of forum than we are, but we are getting to a point where, you know, we do need to be seeing families more and spending more time with children. There is no substitute for that interface, but I think we're going as far as we can in the circumstances that we find ourselves in. Tash? I'm going to need to speed up a bit before the director comes in, because I think this is it's quite a big presentation. I've talked about how we were supporting our fostering services and how we're working well digitally. So I think we can move on to the next slide, Tash. Yeah, and just in terms of just to give our reassurance really regarding supporting our care leavers, and you'll see this from some of the stats. You know, I've made different decisions this year in relation to COVID, and hopefully they've been the right ones. We've slowed things down. So youngsters that would ordinarily have been part of a step-down plan to move back into the community and live either semi-independently or maybe independently have slowed down or stopped. And those other youngsters we've encouraged to stay in placements, recognising their level of vulnerability really. So those plans will speed up as time goes on, but for now we've made those decisions based on the safety and well-being of those most vulnerable youngsters. I can see Mr. Jarrett is writing in the chat how much time I've got, so I'll if we can move swiftly on, Tash. Okay, and that's just, you can read about this. This is just talking about the work we're doing on youth homelessness, and we are Neath Talbot is involved with on a national level with regards to youth homelessness. We are leading the way with regards to some of that work. Moving on. Okay, and again, just key messages from me with regards to safeguarding. Obviously, that continues to be our #1 priority across the directorate, and I'm pleased to say that those arrangements that we put in place at the start of the pandemic are still holding and very well embedded now in terms of working with our multi-agency partners across children's and adult social care. Moving on. And we've seen the only other thing I would say is that we have seen a difference in our referral rates at the front door. So we've seen a time where they've slightly increased, where they've decreased. To be honest, we haven't been unduly concerned about that. But what we are seeing is a rise in serious domestic violence referrals and child neglect referrals. And I think they are indicators of how much pressure families have been under now for a very long time. Moving on. Okay, so that's still, and that gives you some data with regards to the safeguarding arrangements, which you can read yourselves. Moving on, Tash. Okay, Ali Davis has given an update on youth justice and early intervention service. Can I just say that team, that service are working incredibly well. They've continued to go out and support youngsters during COVID. They were very busy over the Christmas period. An issue that I would raise is around the length of time young people have been left on remand, given the positions of the courts, and that's something that we have taken up, and that's been recognised. Moving on, Tash. Yeah, and that gives you a list there of all of the things that they've been involved in, and you can see that all of the meetings that they were an interface, all of those meetings are happening virtually. Moving on. Okay, and again. Yes, and that gives you some detailed information around our front door, our single point of contact. All I would say is that we are very well resourced in the front door. We added additional resources during the Christmas period. We overstaffed ourselves with regards to those working out of hours and those working at the front door to ensure that we could respond to those referrals. They continue to work very well with partners and with families. And although there is that rise with regards to domestic violence and child neglect, there are very robust arrangements with within the front door, and also very good step-down arrangements with our team around the family service. And they were all working over the Christmas into January with families 7 days a week. Moving on. There you are, and that gives you some data with regards to the referral rates and the nature of those referrals. I won't say any more than that because I can't actually see them, so they are so tiny. But I will answer questions. I'm sure you'll have some. Okay, moving on. And again, that's even smaller still. All right. Okay. Yes. So just some comments really on our community children's teams. What I would say is that it's been a business as usual approach as far as possible in COVID times. Just to reassure you with regards to safeguarding, these social workers, the frontline staff, the support staff, they're in families' homes. They are carrying out their statutory function as key workers. They're in hospitals, they're in residential settings. As Angela commented, we have across the directorate a RAG rated system. So that's red, amber, green. All of those red cases, your safeguarding cases, we are responding in that way. And obviously for some of those higher end amber cases, we're doing the same thing. And with regards to those green cases, we are responding to families virtually. But if we see worries, concerns raising, then we will move those into an amber or a red status. Okay, moving on. Yeah, just to comment on maps, because I think that's important. We have a regional service that works again with our higher end sort of complex needs end of the service. Over Christmas, again, they were forming sort of support arrangements around those families with youngsters that were at risk of coming into a residential placement. They were already in care, or maybe even looking at a secure arrangement. And the impact on MAPS across the region has meant that we've got very healthy arrangements with very few youngsters escalating into those specialist services with regards to residential and secure. Moving on. Yeah, and that is that's talking about some of the things that we need to be working on moving forward. And I guess one of the things I'd comment on there is in relation to that support around mums that have had babies over Christmas. We had several mums in that position where that 24-hour support was required in order to ensure the safety and well-being of the new baby. And also, obviously, we have a duty of care to mums that are often very vulnerable. And just to say that we had a team of staff that worked, as I said, over Christmas, that fortnight, and we're in the hospital, you know, with that risk of COVID, and they did that really without any complaint. Moving on. Yeah, and again, that's talk. So that's our family, our FAST service. So it's giving you some detail around how involved they are with us, right the way throughout the last 12 months, but over the last couple of months is showing how much work they're doing virtually and an interface with families. And as I say, they're in families' homes, they're in hospitals, and they are supporting vulnerable children and families within the communities. Moving on. That's it. Okay, my apologies for it being my apologies for that being in too much detail. As I said, I think the principal officers wanted to show what they've been involved in doing over the last couple of months. But hopefully that gives you more than a taster of what Children's Services has been involved in. I'm happy to take any questions.
Thank you very much for that. I think what that indicates is the enthusiasm of the staff. If you're proud of what you're doing, you want to show people what you're doing, which I think is a very good sign indeed. Before I go on to questions, and I know the director wants to come in, I'm blown away by that thinking outside the box. I mean, that idea of having a holiday let and having the family in 2 separate buildings but next door to each other. No wonder you wanted to tell us about that. That's brilliant. Now, I can see the director wants to come in. I can see Councillor Paddison, but Councillor Kerry Clark was indicating, as now has stopped indicating. I'll just ignore Councillor Kerry Clark until she decides whether she does want to come back in again. Right, let's go for the director first of all.
Yeah, just to say, you can tell, Chair, the sort of command and control that we have in social services, so that when I tell my heads of service that do 3 or 4 slides, they stick to that like glue. No, apologies for that. What I was going to say is, I think Kerry was probably expecting that the presentation was shared with members beforehand, so they could read it and answer any questions. I don't think that has happened, and so they wouldn't have been able to read it as Kerry went along. What I suggest is, if there are detailed questions that members have, if they email us, what we'll do is we'll do like a question and answer, which we can append to this meeting, so that all members are able to see any of the questions that are a result of members reading the detail that Kerry put in the slides.
I think that's an excellent idea. Thank you. Councillor Paddison, did you have a question now?
Yes, please. Yeah, thank you, Chair. Yes, I had a bit of problem with the chat function, and I did see somebody mention something about having the presentation sent out to us. Is that going to be happening?
Yes.
Right. Because obviously members who are on the corporate parenting panel, it would be if we could have it before, I can't remember when it is, but it's coming up very quickly. So if we could have that, that would be wonderful, because then it would give us questions for the corporate parenting panel. Thank you.
Excellent. I suspect that there may not be many questions at this stage, because I think the majority of the committee would like to read that wonderfully detailed set of slides that Kerry's staff have presented to us, so that we can study it at our leisure. I say, absolutely blown away by the detail into which they've gone, but it does show a great deal of satisfaction in their jobs, which is excellent. Councillor Lockyer, Cabinet Member.
Yeah, sorry, I know a lot of thanks have been given out today, but I mean, I don't think you can give too much thanks. I just want to, as the Cabinet Member for Children's Services, to thank Kerry and the team there. They have been working extraordinarily hard, like the adult services, and it never fails to impress me and bowl me over exactly what they will do. And I know we've mentioned skewing, but I mean, that was just a typical case. You know, we've had since over the last couple of years, we've had several real sort of, for want of a better word, disasters. And you know, people sometimes don't realise that it's not just the guys who are cleaning up the streets. This spreads out like some massive wave as the water spreads. So the services that's needed to support that spreads. But without fail, everyone within the council has really stepped up, and you can see that with the fact that all that was people were the main thing. The people were catered for and sent to appropriate places and things. So just want to express my thanks to Kerry and the team, because they're doing a fantastic job. Of course, led by Andrew, who's been an absolutely tremendous director in dealing with all these disasters that he's taken over. So, but thanks very much. Yeah.
Thank you very much. What I suggest then, so that we can move on, because we do have the budget to debate next, is that if councillors, members of the committee, have questions, once they've read Kerry's notes, if they do the questions through Charlotte in Democratic Services, so that we can all see what the questions are that are being asked, and we can all see the answers that are being given, I think that will be the most constructive way forward. So both of those presentations were for noting. We have noted, we have expressed our considerable thanks to all, and we are now moving on to agenda item 6. So just give you a couple of minutes to get yourselves organised. So agenda item 6 is to look at the budget proposals as they directly affect our committee. And the idea of this, for any members of the public or press who are present, is to allow members to scrutinise the proposals and to feed into the consultation, because we are the most closely connected with any social services implications, and therefore obviously our comments and questions and observations are a very valid part of the consultation. So we are at the budget. I had a very interesting debate. We all had an interesting conversation during pre-briefing, and I have got a list of questions. So Andrew, do you want to present first, or do you want me to go straight through to the questions?
I think, Chair, it's really important I just do a very brief presentation about, not a presentation, a briefing to you about what we've done, because we've done something unusual this time, and you might have noted, in that we have tried to show you our thought processes as we try to set the budget within social care for the coming year. And it's not been easy, and I just wanted to talk you through a bit about what we were thinking, because what we've set out in Appendix 1 and 2 is these are the pressures which we think we need to absolutely have funded for next year, and we can absolutely stand by those. But then there's another set of pressures which we're not so sure about, but which we think will come as a result of post-COVID activity. And so what we are expecting is a bulge of demand post-COVID, where we have all of the, the things that we've talked about already, where we have people who have been absolutely, brilliant managing as carers, who come to the end of their tether. We've got individuals with mental health issues as a result of being isolated for periods of time. We've got children having contact with parents, etc., etc. So we think after COVID, there will be a bulge of demand. Now, what we're not sure about is a number of different things. We're not sure about the government grants that we'll be getting for next year. We're not sure about the hardship fund, and Councillor Clement Williams has been very helpful today in clarifying something which I didn't know around, the hardship fund will go on for some time. And we don't know the extent to which that bulge will have an impact on us going forward. What we haven't been able to do is we haven't been able to say, well, let's look at the budget for this year and last year and take a view then on what might be the pressures for next year, because the budget this year has been like none other that I've seen, because it's been affected by COVID. We've had a lot less spend on some things. We've had to spend more on others, but it's certainly not an indication for us about what the budget would look like for next year. So we have tried to say in the report that we think there's lots and lots of uncertainty about next year. We've got a fair settlement, I think, from Welsh Government, given the situation. They've supported us very well as far as COVID-19 is concerned, certainly over the last year. But we also believe that probably that's going to slow down as we move into the next 12 to 18 months. That sort of support, just because we're not sure that Welsh Government will be able to keep that up. I think if we get the budget that we're asking for, and we get the money for the pressures that we're certain of at the moment, I think this is a really positive budget for social care, and I would commend it to the committee. Because we've got such a significant uncertainty, I think there may well be unfunded pressures in year, but I'm happy to see them as unfunded pressures in year, and I think it's important for the committee, if we do start to get those pressures, I'm able to come to you and talk to you about, look, these are the pressures we're seeing post-COVID. I did raise those issues with you when we were setting the budget, and we've done all of these things to try and keep that under control, etc., etc. So that's the basis upon which we've presented the budget to you today. As I say, it's a bit of an unusual way of doing it. I hope that's not going to cause particular difficulties for the committee, but I wanted just to explain the basis upon which we've done it. Happy to take any questions.
Thank you very much for that explanation. So I honestly don't know how you've managed to set a budget at all, to be quite honest, but we take on board everything that you've just said. My first question, which I actually sent you in advance, I think possibly is unanswerable, but it was, you were talking about our spend in this financial year, page 17, cannot be a predictor of demands for the future. I just wondered, in layman's terms and ballpark figures, what you'd actually had to spend compared with what you expected you were going to spend when you set the budget this time last year. If you haven't got an answer to that, it's totally understandable, but I was just curious.
Yeah, it is really difficult because we have had the support from Welsh Government, specific grants around COVID. So that has very much helped with our spend overall in relation to COVID in particular. So it's difficult. I mean, I suppose what I was trying to say was, look, it's likely that we will have as a social services budget at the end of this year an underspend. Okay, and I think that would be a significant underspend because at the moment, you know, we've talked about residential care and the falling numbers of people in residential care for obvious reasons. So I think there'll be, you know, we're forecasting 320 odd thousand pounds underspend on our residential care. Well, we never normally underspend on that budget. Learning disability, 560,000 underspend is a ballpark figure that I'm looking at, and that's because people aren't using the services that we're providing. You know, families are struggling at home, where it is really difficult for us to support them when we're all locked down in COVID times. So I think there will be a significant underspend for this year. And I suppose what I'm saying to you as a committee is we can't use that underspend as a précis for what might come next year, because I don't think that you know, we will have a rerun of this year. Well, I'm hoping we won't have a rerun of this year. I'm hoping that COVID will be then a thing that we have to deal with, but the impact of it will be not as great as it is we've seen over the last number of months.
Okay, brilliant. I'm totally prepared to accept that. Thank you anyway. Right, going through the questions that we had in pre-briefing, we're starting with Councillor Woolcock on page 17, talking about future contingencies.
Thank you, Chair. Yeah, it follows on really from Mr. Jarrett's introduction to the report, Chair. And I'm referring to page 17, right at the foot there, the final paragraph, where it says, as always in a service that responds to statutory need, there is a significant element of trying to predict what might happen in the coming years alongside the additional pressures that are already known. And the significant part, there is a significant element of trying to predict. So my question, Mr. Jarrett, is how confident are we that we have budgeted sufficiently? And what contingency would we have towards anything over and above that?
Well, having said all of the things that I've already said, Councillor Woolcock, I think we've done our best. I don't think we can be certain. I think that was the point for me. We've got to take a reasonable view, I think, across the council about what our spends might be. So across the council, I would, when I'm talking to director colleagues and the chief exec, we're expecting higher demands next year across the council, and we've only got so much money that we have to spend. So I think I've got to be realistic in what I'm saying as far as the social services, balance that with the rest of the council's needs. I do think there'll be additional pressures, but I also think that that Welsh Government will continue to support local authorities during the COVID times, and I have to think that because otherwise I think some councils will be in real difficulty, not Neath but Talbot, but other councils that don't have the reserves that we have. So if we get the money that we're expecting from Welsh Government, then I'm confident that, as confident as I can be, that we will be able to manage. But I can't tell you the exact nature of the additional demands post-COVID, because we've never been in this situation before. So I don't know the extent to which we will need more mental health placements, for instance, as a result of COVID-19. I'm expecting there might be some more, but I don't know exactly what that will look like. What I can tell you is that myself and officers will be doing everything we can to make sure that we're supporting people within the budget that you agree as a council. And I think at the moment, as I said in my opening, I think it's a reasonable budget request from social services. And if this budget is approved for us, I think that we have a really good shot at making it work.
Thank you for that. Are you happy?
Chair, if I could come back there briefly, I did omit to say what I said actually at the pre-briefing. Andrew, there is a report today from the British Association of Social Workers, and they describe it as, quote, a tsunami of needs, unquote, as the UK recovers from the pandemic. And they reckon that workloads will increase as restrictions are lifted. So it all fits in, and I fully understand where you are coming from, because what comes to mind is how long is a length of string. So, you know, I appreciate and I do fully appreciate and understand the difficulties that you are facing and have faced. Incidentally, well, I don't know how on earth you do it, quite frankly.
Thank you for that. Councillor Reynolds, did you want to follow on from that, or are you happy with the
I think my questions have been mostly answered by the initial input and what has been said by Andrew. However, I did want to make the point that, you know, our reserves are going down. They are already slightly below, if we work to this year's budget, what we're supposed to have by Wales Audit Office requirements. So though we're in better position than other councils, this is not good looking forward. And I think we need to be aware of that all the time when we're looking at what comes in from other governments and how we use our money. Thank you.
Thanks. Thank you very much for that. Councillor Paddison, you wanted to talk about income generation, page 14.
Yes, I just wanted to clarify, Mr. Jarrett, that the 135,000 figure there, is that the arrangement with Bridgend to help with the disability grants, you know, the adaptive grants? Is that what you're referring to there?
So page 14.
It came to cabinet not far ago.
Yeah, no, that isn't that amount of money, because we haven't put that amount of money
right.
I think that's the council wide. So that the first bit of that is the council wide income generation, rather than income generation just from social care.
Yeah.
So I don't think there is. We haven't agreed any amount for income generation within the social services department.
Oh, so right. Well, I misunderstood
the council side of it.
Right. Okay. Thank you for the clarification.
Okay, thanks for that. Councillor Goldsworthy, you wanted to talk about the neighbourhood.
Yes, thank you, Chair. In page 19, it basically says about the further 1.7 million to develop the neighbourhood approach, building safer and resilient communities. I'd like to know, obviously, what's your thought in how you go about that, and also, given the changes in our communities now and obviously going forward, and picking up obviously different issues such as, you know, identifying some people that are not in our services and not known to services, and they're not in a social housing provider as well, where they've had sort of staff looking in or things like that. I'm just interested in knowing, how are you currently mapping that situation, and what's your vision of how you go to creating, obviously, and spending that fund?
Okay, and that again, that's been difficult. So our neighbourhood approach, you will know it as building safe and resilient communities in Neath Talbot. We piloted before COVID. We were piloting in 2 areas across Neath Talbot this approach, which is a community strengths-based approach, looking at assets within communities. As we moved then into COVID times, we took a decision with Welsh Government agreement that actually we would halt that because we needed to create something which would respond differently, which was the Safe and Well service. So the Safe and Well service was set up to respond to those who were shielding and particularly vulnerable when the country was locked down. And it took a lot of the learning from building safe and resilient communities, which was that strengths-based approach, using people who knew the communities to better effect. I think, my view is that Safe and Well took the sort of building safe and resilient communities work to a different level as well. So they learnt their lessons from building safe and resilient communities, but took that further. And they took that further in the way that they used local councillors, for instance, where they used their local area coordination and other staff much closer. So I think going forward, there's a discussion across the council for us to have around, well, actually, what comes next from Safe and Well, and that's the bit that we'll spend that money on developing. It's really important for us in social care. We've talked about the uncertainty of the budget. But if we don't get the early intervention prevention agenda right within our communities, then what I am sure about is that demand on our acute side will be so much greater. So it's really important that we get that right. It's not just a social services approach, though. What I am resolved to do, in my mind, because it's worked so well, is put councillors front and centre of helping us to deliver that. And so that will be a part of our planning as we go forward. We're not going to do this away from you. In fact, we want to understand the lessons that you've learned from working with the Safe and Well service and how we then take that to the next step. So that's as far as I've got at the moment, Councillor Goldsworthy. And of course, we haven't had a lot of time to think about that because we've been responding to the emergency situation. But we do recognise that next year is coming up fast and we'll need some plans. So we are talking to the chief exec, other directors about how we work together to put something together. And I know that there are conversations with councillors going on around, well, if we roll this out across the whole patch and we've got £1.7 million to spend on early intervention and prevention, how best are we going to do that and how do we put councillors in the front and centre of that?
Thank you very much for that. That actually anticipates my question that I was going to ask about Safe and Well and how that will be further developed. So thank you for anticipating that one. Councillor Paterson, you thought you may want to come in here, but you weren't quite sure.
No need, Chair, no need.
Oh, right, you are actually the next one on my list anyway, Appendix 2 about homelessness.
Yes, it's on Appendix 2, I beg your pardon. There is an amount of 400,000 outlined for homelessness. Now, we have had lots of warnings of people who may be in financial difficulty with their mortgage, taking mortgage holiday payments, being just at the basis of what they can cope with. And we do know that, if you default on mortgage payments, you are deemed to have made yourself homeless. Now, I just wondered, under the present conditions, with people being laid off and furlough schemes coming to an end, people having to take time off with looking after caring responsibilities, how did you arrive at the 400,000? And you obviously think that will be sufficient, but I'm just a bit wary that it might not be.
Yeah, I mean, Angela might want to say something about this, Councillor Patterson, but from my point of view, we thought that there was going to be increased pressures, and so we wanted to build in additional monies for that. But you'll see in the report that as we were working through this, we got notification of significant additional funds that were Welsh Government funds for next year around homelessness, which I was looking in the report, and apologies I can't find it, but it was about 1.5 million.
Yeah.
So that's a significant amount from Welsh Government, which allowed us to reduce the amount we wanted to put against homelessness, and that gives us the opportunity to develop services for the longer term. So I think we're in a much better position. I don't know whether Angela wanted to say anything else on that.
Yeah, we'll probably be bringing that paper to this committee anyway. So I was working through that actual proposal this morning to strengthen all of that. It is 1.5 million recurring monies. So, and it's not just at this directorate, it also expands to some of the corporate strategy stuff, including the violence against women, the drug and alcohol enforcement officers in the environment. So it is a whole council approach to homelessness as opposed to just social services.
And if I may, Chair,
sure.
Mr. Thomas, if we have got additional monies coming from Welsh Government, is it our plan then that if we needed to, we would house people in any way that we could see from the private sector, or might we take some part ownership in something so that we're not paying out constantly?
Well, there's a couple of issues to that, and that's the strand in the short, medium and long term that I spoke about earlier. So there are some initial thoughts about acquiring, well, we've got some accommodation, for example, in Getley Gron, where we're converting that to, so there's that bit of work. There's some other areas, and we're working with a couple of RSLs, a significant number of RSLs, about securing more units and moving away from the hostel type accommodation. That's the longer term plan. So happy to share those plans with you. Like I said, there's a meeting tomorrow morning, so we're firming things up, and happy to bring that back in future. In terms of the not paying the mortgages bit, it's an unknown for all of us at the moment. We're all preempting the words.
Yeah. I look forward to that then, Chair, you know, to see what officers are going to come and put forward. So look forward to that. Thank you, Ms Thomas.
Thank you very much. Councillor Kerry Clark, you wanted to continue this theme of homelessness.
Yeah, on the subject of homelessness, I appreciate you've done this budget before last week, but obviously the displacement of people in Skewen, and some of them without insurance, is that going to have any impact on your homelessness budget? And in addition to that, is there a contingency in that budget for instance, you know, Angela was just saying we're all unsure how much people are being made homeless through losing their homes through not paying their mortgages is going to happen. Is there a contingency in case it's a number larger than we could even imagine?
The numbers that I've quoted to you there are the numbers that have been since COVID, so they don't relate to anything post-COVID. What we've seen is we've moved lots of people on, so that's not a stagnant number, we've moved people on, but we're plateauing around the 130 plus mark of people, individuals who are presenting as homeless, where we have a statutory duty to rehouse, basically. I have no knowledge at this point in time of what might happen post, but what we're doing is strengthening our arrangements to deal with that. Now that may not be physical accommodation, but it's particularly officers who can help with the welfare checks, everything that's required around things you talked about there, practical arrangements for people who are going to present as homeless. So we're building all that in. I think it's to echo what the director said. The whole budget this year is a sort of, you know, unknown. We're preparing as best we can, but undoubtedly things will change throughout the year, and we will have to react accordingly. In terms of the issue around skewing and insurances, etc., I believe that's all being dealt with by Howell Jenkins, the director, in terms of that part of it. So I think they divvied up certain areas of work across some of the corporate directors. You know, Andrew will be more averse to speak about that than myself.
Chair, is it okay if I come in?
Yes, certainly. Thank you.
Yeah. So on the skewing thing, I'm not expecting there to be a big bill for social care as far as that's concerned. We're utilising our own staff that are already being paid, so that's not additional funding. As far as rehoming and rehousing, we will take that into account, but I'm guessing that will be a centralised budget, which we will then look to be supported through Welsh Government or through any organisation that might have liability in that area. And as far as contingencies is concerned, it's an interesting one, isn't it? Because when you're in a demand-led service, so as a statutory director of social services, you know, I could take a view that actually, you know, probably need another, I don't know, 10 million if I was going to take a worst case scenario, and all the mitigations that we made, and all the uncertainties we get. So we don't get any money from Welsh Government. We don't manage to stem the flow and do the early intervention prevention in the right way. That something else comes along next year, which means that we have additional demand. Well, I just think that's probably not the way that you as a committee want us to respond. We've got to take a view of actually what is a reasonable budget for us to ask for, given the restraints that we've got, and then we work towards that budget. I think what I've got to have faith in is that I can come to you as a committee and you as councillors in the future, if we do have additional pressures, and say, look, I've done my best around this. I can explain what we've done, but actually there are some additional pressures which either we didn't anticipate or we didn't anticipate enough. and that you will understand that, you know, we've tried to build that in, but it was never a perfect science.
Yeah, okay with that? Yeah, happy with that? Yeah, okay. Completely different now. We're on SSHH 58, and Councillor Wyndham Griffiths had a question.
Thank you, Chair. My question is, oh, I've lost it. There we go. Excuse me.
It's page 18.
It's page 18, and it's on SHH 58. Why is it costing so much to convert a bed from residential to EMI, and how do you come to this figure, and is it going to be an ongoing thing? Thank you, Chair.
Do you want me to take this one, Chair?
Yes.
Okay. This is, as I mentioned earlier, what we're seeing is a rising number of people with early onset of dementia in the community. And given that we have spare capacity in the residential care world at the moment, what we've been doing is talking tentatively to some of our partners about whether we could convert a number of beds from residential into EMI nursing, and the difference in that is about £30 a week. It's not a huge amount of money, with a view to seeing if that's so people with these particular dementias don't live very long. Their life expectancy isn't very long, but we're looking to pilot to see would this help, because if people have got lots of voids in their care homes now, which they have, as I said, occupancy levels are low. Should we pilot some of this? Because what we're seeing coming through our funding panels is a significant rising number of younger adults, I'm talking late 60s, early 70s, presenting with something called Lewy body dementia, and it's a very aggressive, progressive form of dementia, and you can't be managed in your own house for very long when that happens. So this is purely, it's none of us know what's going to happen with residential care in a year's time. So we thought we'd try and pilot this and see if this does make a difference, given that we've got a surplus of residential care beds. So it's not a huge amount of money, and obviously we're talking to providers because not everybody wants to do this, and it will mean additional people, staffing, etc. So it's purely a very small pilot at this point in time.
Thank you for that.
Can I come back
to that? Where have you gone? Yes, you want to come back?
Yes, please. Does this mean that this aggressive condition that you just spoken about, does this mean that it needs nursing intervention?
Very often it's a residential nursing care provision, yes. Yeah, as I said, a lot of our residential care provision now are dealing with the heavy end, people with dementia, and I think all of this would need to be looked at when we come out the other end of COVID.
Yeah, okay. Thank you. It's very interesting. Thank you very much.
Thank you for that explanation. I've got Councillor Kerry Clark and the Director indicating. Did you
just wanted to mention the Lewy body dementia. It's a form of Parkinson's, if that helps anybody.
Right, okay. Thank you for that. Director, did you want to come in now?
Yeah, just very briefly, and I don't know, I'm not an expert on this at all, but what we are seeing is, what we think anyway, people who are who are developing dementia are staying in care homes longer than they should, and where they actually probably need nursing care. And so there is that bit around actually, you know, how can we provide better for their needs? And by converting beds, we think that's that may well be something which we can do at this stage.
Thank you for that. That certainly is an explanation that I was looking for. So I'm grateful to Councillor Griffiths for asking that, and for Councillor Kerry Clark for giving us the advantage of her expertise in this area. Brilliant. Right, now, at this point, we expect to be coming to the end of the discussion, except that we have actually had quite an interesting debate in pre-briefing about possible income generation, which I'm sure the Cabinet Member for Finance will be delighted to hear. So we'll hand over to Councillor Reynolds.
Not a new idea, and Carol is aware that I've raised it before, and I'm sure others have as well. And this is, as we move out of COVID and we can start to move people around in and use our buses and our activities again. We are looking at a number of organisations and communities who are looking for bus services and looking to take groups of people places. Now, I know there are barriers in the way of us making money out of our social services buses, but I don't think they're insurmountable. I think they just need a bit of work and a bit of thinking to overcome, and could include employing drivers and charging for them, because we would have, organisations would have to pay for that anyway. Membership schemes to do this, or working with our existing community transport organisations. So just a thought.
Thank you for that. I can see the Cabinet Member for Finance wants to come in to respond probably to that. But I've also got Councillor Griffiths, Councillor Wyndham-Griffiths, you had some thoughts on this as well before we go to the Director and the Cabinet Member. Are you there, Wyndham?
Thank you, Chair. Yes, there's an old saying, it's invest is to save. So
you're breaking up.
By doing what Councillor Reynolds has said, I know that when we discussed in pre-briefing that there are steps that have got to be taken, i.e. to charge for the buses, you've got to hold a certain licence. But we in the council can overcome that, because we have a training facility in the council because we actually train all our HGV drivers. So we've got the expertise in the council. So if we trained our drivers to come up to those standards, we could provide the service, and the monies that we acquire can be put back into social services, and we can also create jobs for other people. Thank you, Chair.
Thank you. I can see that, as I say, the Director and various officers want to respond, but I just want to let this idea run. We are not experts, but Councillor Dave Whitelock, did you have any observations to make before I go back to the officers, the Cabinet Member?
Yes, Chair. We've been talking about this for many years, as you know. When I worked with social services, I can actually say last century now, it was a discussion then, and it's the difference between the PCV license and PCV, which is passenger carrying vehicle, and the insurances for these vehicles. Now, in my day, we had a fleet of some 30 odd vehicles. I don't know how many we've got now. But to hire them out, I would say, because of the downtime of the vehicles and the drivers' hours, it's such a complex thing. I don't think, personally, without a heck of a lot of work going into it, we'd make any money on it. This is why we give up all the school contracts at the time. We used to do all the special needs schools at one time. But with such a loss on them, and of course, taxi firms now go in at such low rates with a minimum wage, which are below our drivers' wages, I don't think we'd compete on it anyhow. So it is a good idea, but it would need a lot of work, and I'd be willing to sit down with anybody and have a chat about it and look at the figures.
Thank you. As I will come to the officers now, the Cabinet Member, but I did just want to let that idea be aired, because we are in such difficult times. We do need to try and think outside the box, and I didn't want to give up on that idea before we began. Now, in order of priority, I've got Head of Adult Services, the Director of Social Services, and the Cabinet Member for Finance. Do you want to fight it out amongst yourselves? Who wants to go first? Anybody strong preferences? Councillor Clement Williams, do you want to finish it? Come up at the very end of this when we're rounding up this debate?
Yes, please.
Yeah, okay, so let's go for the Director first. Mr. Jarrett.
Okay, so my view is, so we've looked at this before, to my knowledge, on a couple of occasions, and struggled to make the numbers work. But that doesn't mean we shouldn't look at it again. So I'm happy to give a commitment that we will start at least a scoping exercise. And this isn't just about social services. This is across the council, because there's other vehicles and access to vehicles that we have across the council. Happy to look at scoping again. I mean, clearly, if it's a goer, we want to put the time into it. If it's not going to be something which is likely to bring in money, then we shouldn't put lots and lots of effort into it at this stage. But I am happy to do a scoping exercise again. And if Councillor Whitelock is interested in giving us some advice around that, then happy to do that.
Brilliant. Thank you very much for that. At least it's flying a kite, but we've got to try everything. Councillor Reynolds, before I come back to everybody else who's indicated, are you happy with that, the director's prepared to do another scoping exercise and taking on board Councillor Whitelock's knowledge about this as well?
I'm happy as long as we can see the outcome of it, because I am concerned. It's been raised before, and as far as I'm aware, there's never been anything returned on it. So it would be good to know why it doesn't fly.
Yeah, I'll bring a paper back, Chair.
Thank you. Angela, do you want to come back in at all, or are you okay with what the director has said?
Yeah, obviously I'll go with what my director says. I was getting a little bit confused on this because where Councillor Whitelock mentioned then about not being able to compete with taxi drivers, I've got a huge issue with taxi and companies and what they're charging us in social care. Yeah. So that's a separate piece of work I'm looking at. And of course, the social services transport doesn't sit in social services, it sits in the Environment Directorate. So I'd be struggling to see how we take income generation in social services for a service that's provided in another directorate. But yeah, happy to look at it because we're looking at the transport issue around taxis anyway. So
brilliant. Okay, this is getting a bit confusing, but I've got the Cabinet Member for Finance ready before we sum up. But I've also had Councillor Paddison saying, can she say something before we go to the recommendation? So Councillor Paddison, do you want to come in next?
Yeah, thank you, Chair. I just wanted to say I would totally understand the director's plea to us as a committee that he's put the best budget forward as of now, and he hasn't got a crystal ball, neither of any of his officers, so that if he were to need further funds, we would be hopefully in agreement with that at the time. But we'll go with what, obviously the vote will tell you later on if we go with it, but personally I would be willing to sort of take these recommendations with that proviso. Thank you.
Right, now I've just got to handle this a bit carefully. I've got the scrutiny officer wanting to speak to us, and obviously the Cabinet Member wants to come in before we actually go to the recommendation. So can I go to scrutiny officer Charlotte first?
Yes, Chair. It's just I can see Councillor Galsworthy's hand is up. So before you went to the Cabinet Member, and before everything's summarised, I just wanted to check if Councillor Galsworthy had another question.
My hand is up.
Oh, sorry. It's gone back down now. So sorry.
No, I couldn't
it
see
might have been a legacy hand.
Yeah, thank you for spotting that for me. Thank you, scrutiny officer. Right, before we go to the recommendation, finally, very patiently, we have the Cabinet Member for Finance. Okay, take it away, Councillor Clement Williams.
Thank you, Chair. And a few things there. Apologies to Sonia. She has brought this up with me in the past. It is something that I had raised. Unfortunately, and it was a while before COVID, income generation is in my portfolio. However, it has taken a real backseat since COVID has hit. It has been one of those things that I'm afraid has been a real casualty of COVID. It was something that I'd raised, and I'm happy to bring it up, working with the director in our income generation. We do have a panel, income generation panel, and it'll be something we could bring up there and report back to you on. Couple of things really. With that, I do have a little knowledge because I did used to work in a big building in Morriston around the licensing issues. The up to 16 passenger seats, you would have to have a D1 license if you're working for hire or reward. over 16, it would be a D license, but you also have to have a PCP license now, which has to be renewed. I think it's every 5 years, but you've got to do something every year towards that qualification at the end of the 5 years. So there is issues, or there are rules that you need to follow on that one, and we would need to have a proper business plan, etc. As for budgets, yeah, a year like we've never ever had. I pay tribute to all officers within the council, and our finance guys have been amazing, and that's within all the directorates as well. This is why this year we have backed up our spending for next year with over 3 million from our reserves, and there will be no cuts this year, to try to relieve that pressure, because officers simply have not had the time to look at these things as they normally would have. And my hats are off to all of them. They've done an amazing job. They are now multi-skilled, multitasked, worn out. They need a break. It would be lovely if, excuse me, being a little bit political, if the Chancellor would thank them and give them a good pay rise. I certainly would if I was the Chancellor. And I just have to say this to back our staff up. If it wasn't for local government, our country now would be in a terrible state, because it's local councils all over the UK that have stepped up to the mark and picked up the baton and run with it. And our staff, who have been amazing, that have got us through to this stage so far, and we're certainly not at the end. So I want to put that on record, that I don't think we can ever be grateful enough to all of the staff within the council, and that includes senior officers, councillors, all staff of every grade. It blows me away every time. So, as the director has mentioned, and Angela has mentioned, we've worked very closely with the Welsh Government. There is a lot of unknowns coming up, but I have to say, if Welsh Government continue to work with us the way they have, a lot of these unknowns are being dealt with and tackled along the way. We do put in a bill, if you like, to the Welsh Government on any new incomes that we are generating through the COVID for extra claims, and pretty much we've had most of it back. As for the skewing, which has been brought up, we have had, as I say, that message I gave, Andrew probably wouldn't know about it because we've literally just had it. It's quite hot off the press. We've had to go ahead now to pay the monies that Welsh Government have provided for the homeowners that have been displaced for over 24 hours, either with a £500 grant. There is a form available. I believe that there will be a call board meeting for residents next week, and they will give more information on that. But there'll be £500, or if you're not insured, £1,000. So Welsh Government will be very quick to react to these things. So what I would like to say to members is, I think that we don't need to panic. Very, very good questions, and quite rightly so. It just goes to show that our councillors know what the issues are out there. But I'd like to reassure them by saying Welsh Government have worked very closely with us, and I hope long may that continue. However, again, they haven't got a bottomless pit of money. It depends on what they get from Westminster. But I believe, from the work that I've been doing with the ministers, that as long as they have it, they will pass it on. Good luck to the Directorate for next year. You've done amazing work, and I always here to help if anybody needs me. Thank you, Chair.
Thank you very much for that. So finally, after a very detailed and in-depth debate, we come to the recommendation, which is on page 20, which is simply for us to review and scrutinise the proposals. And are we happy for the proposals to go through to the Cabinet in their present form? Yeah. If you could just give me thumbs up or nodding heads, that's lovely. Thank you very much indeed. Right, okay.
Chair, before we move on, if I could just come in.
Yes.
Yeah, so just to remind members that all the comments that have been raised today will be included in the minutes, obviously, especially the income generation ideas, and they will feed into the consultation. So all the budget meetings that we've got, that will happen. And just to double check with members, I know you've just said that you're happy for them to go to cabinet as it is, but is there anything else that you wanted to say in relation to income generation at all? Or if there are any other proposals that you wish to raise before we moved on. I know you've mentioned a few, but just to get clarity that everything that you've mentioned is included in today's discussion.
Right, are we all happy? Yes, excellent. And I'm sure if you have any bright ideas about anything we can do, you will be very swift to pass those ideas on. So that was the recommendation. That's the end of the budget debate. But we now have Agenda 7, which is the Forward Work Programme. I think, to be quite honest, we need to proceed and get through COVID a little bit further before we do any creative thinking. But is there anybody who wants to say anything about Agenda 7, the Forward Work Programme? It's just for noting at the moment. Unless you indicate, we'll move on. Right, excellent. Now we get to the urgent items, which I have none, as far as we know, no other disasters since we've been on in this committee. Right, now we have decided we do want to scrutinise a cabinet item, so we have to deal with access to meetings now, and we have to politely request any press or public present to leave. So here we go. To resolve to exclude the public for the following items pursuant to Regulation 4, 3 and 5 of Statutory Instrument 2001, number 2290, and the relevant exempt paragraphs of Part 4 of Schedule 12A to the Local Government Act 1972. So can I have a proposer and a seconder to move into private, please?
Move, Chair.
Yeah, thank you very much. At this point, I would like to thank any members of the public and press for joining us this afternoon. Could I please ask that you leave the meeting, and could I please ask that the recording of the meeting now be stopped? And can